All right, thank you, and welcome back to the Lightning Step Couch. My name is Benjamin Turner, behavioral health advocate. Sitting with me today is Athena Phillips, the founder of Integrated Trauma Treatment Center in Portland, Oregon. Athena, thanks for joining us.
Thank you for having me.
Great. I just want to ask you a couple questions. But first of all, can you tell us a little bit about your organization and why you founded it 10 years ago?
Sure. There are a few components to my organization. The first of which is we're a clinic. We're an outpatient clinic in Portland, Oregon, which I started, as you mentioned, 10 years ago in response to having been in private practice for 5 years and recognizing I specialize in dissociative disorders and complex trauma. And there, a lot of my clients were really struggling with going to the doctor or taking care of their bodies, but I viewed the body as integral to the healing process.
Absolutely.
And at that time, it really wasn't, we weren't really thinking of it in that way. So I wanted to create a place where we could create some safety for people to include their body in the healing process. And we provide a variety of integrative services
That's awesome.
as part of it. But we've also launched something called Kalos, which is a global platform for continuing education in mental health in effort to elevate voices of people from all over the world in the field, learn with each other, alongside each other, and grow together.
Awesome. Awesome. Can you tell us a little bit more about that platform? How does that work? What kind of services do you provide within that specific program you just mentioned?
Yeah, we provide a few things. We provide courses, of course, so continuing education courses, but there's also an online membership community where people from all over the world can share their expertise, ask questions, learn about mental health through a variety of lenses, because, we believe that every culture has something unique to offer and conceptualizes problems and solutions in very different ways.
That's great.
So it's an online
Resource
yeah,
for
platform.
platform for a lot of things. I love that. So I want to talk a little bit about improving access and reducing barriers to behavioral health services. So can you tell me, how can telehealth expand access for rural or mobility limited populations? How can telehealth affect that or benefit them?
Well, one of the gifts of COVID,
Hmm.
it was obviously a really painful time for the
Sure was.
world. We learned as mental health care providers how profoundly, I don't know, our delivery of healthcare changed because we were able to reach people that we otherwise couldn't. Our no-show rate went from, I don't know, it was pretty low in the beginning, but it went to almost zero
Yeah.
because people could make it to therapy. They weren't confronted with, mobility
Mhm.
challenges or public transportation, not showing up or whatever. So we were able to really reach a lot of people regardless of where
That's
they
great.
resided in the
Yeah.
state.
So telehealth really benefited you and has really expanded care to those folks, having
Yeah.
that access to it. That's amazing that you offer that. Um, how are services made affordable for uninsured or underinsured folks at your organization?
Well, we've done something unique. I've traveled to a lot of places in the world, and accessibility is a problem everywhere.
Hmm.
And I don't really believe that more therapists, more psychiatrists, et cetera, that's not going to be the solution in our lifetime.
Yeah.
So we need to innovate. And one of our innovations is I've written a trauma coaching certification course that is available again globally. We go to low and income countries to share the information and work with our partners in those countries to help adapt it to the culture that it will be shared in. So we do that. But we also offer trauma coaching
Okay.
at our clinic as a way to bridge gaps, provide additional support at a much lower cost.
Awesome. Awesome. How can folks find that platform that you created that you had just mentioned? How can they access that platform? You had just mentioned that you offered something, you had written a course.
Mhm.
How can folks access that course?
Yeah, so traumacenternw.com is our website. So all the stuff is listed there.
Okay, traumacenternw.com.
That's right.
Awesome. I think that's great. So again, I want to thank Athena Phillips, the founder of Integrative Trauma Treatment Center in Portland, Oregon, for joining us. Athena, it was a blast, and I really appreciate
Thank you
everything you're
for
doing
having
in the
me.
industry.
Thanks so much.
Thank you. That was great. Thank you.
Absolutely.
Yeah.